How soon are we also working on international relations? We would think that the fear of this disease is also beginning to affect relations between countries. You understand that, Korean students called off an excursion to West African region. Nigerians who were supposed to go over to Asia were also stopped because of this particular reason as well. How are we doing? What are we doing to ensure that this does not affect our external relations?
Well, it's to talk dialogue. When we're in touch with the U.S. government, they've told me their concerns. One of their immediate agreement with us was that those who are traveling out to United States, we should also help them to screen them, just like we are screening people who are coming into Nigeria. So we are not going to extend it only to those going to the United States of America. We are going to say now both inbound and outbound passengers at our airports will now be screened. So we're moving on to that. What is important is communication between countries. And every country, I can assure you, will not want the disease to spread from their own country. So the whole idea is nobody is taking a decision to punish the others. We are showing understanding. People who now move from Nigeria to the United States of America, when they get to the airport, they are screened. Just like people coming in from outside Nigeria to our airports, our land crossings, we also screen them. So it's some mutual understanding. And tomorrow, I believe after the special meeting called by the World Health Organization in Geneva, there will be even more protocol which WHO will expect countries to abide by. So the question you asked is important. We are working with every country. Even just yesterday, the American embassy visited me, and we had useful discussions.
But what about the intra-state movement? I mean, at the local airports and even the roads linking the different states, are there screening points at state boundaries, at state airports? Or you think that's not necessary?
Well, we have discussed that with all our experts, both national experts and international experts working with us, including both the U.S. Centers for Disease Control and the World Health Organization. The U.S. CDC says that from their experience in the other countries, that such internal restriction of movements is counterproductive. And that the advice to us, given that they learn things from the other three countries, is that Nigeria should not go to that. What is just important, like in the case of Lagos, is to continue to follow up on the contact tracing. That rather than saying people from Lagos, before you go to Ogun State, we need to screen you. That one, we don't have the resources. No country ever has enough resources to do that. And two, it does, from the experience in those other three countries, causes problems. So we want to learn from others too. So that's why there's no such consideration. However, for airports that we do know that people do move on from international flights to those ones, we are providing those screening.
What about, is there, since Professor Iwu was on this team, of course, a lot of messages, information making the rounds now. What's the talk about that article of his, which was published, I think they say, was it in 1999, about this kola nut matter? What's he saying about it?
Sorry, come again.
I mean, Professor Iwu's article that was published making reference to, is it kola nut or bitter kola? He is a member of this committee that has been set up. What is he saying about that?
Now, one of the other things we intend to achieve by setting up this group, this treatment research group, is also to streamline, claims. So they have the mandate now to receive claims. So we don't want pastors, imams now just telling people we can treat Ebola. No. We may begin to see whether we can have laws to arrest such people for giving the wrong information. If anybody has any claim, send it to that committee through the ministry. We have the secretariat in the ministry. They will take every suggestion seriously, work with the claimant, and see whether it is indeed true or not. So coming back to Professor Maurice Iwu, we did know that a lot of Nigerians accessed his article through the internet, and then people started spreading the word that just by chewing bitter kola, not only can we prevent Ebola, but indeed it will cure Ebola. For now, that is a fallacy because the treatment has not been proved. What was proved in 1999 by Professor Iwu and his research team in the United States of America was that in the lab, in the test tube, so to say, that's in the lab, not in any animal, not in any human being, they were able to show that an extract from the bitter kola was able to hinder the growth of the Ebola virus. So it was able to at least slow it or kill it, in the test tube. Now that research was not concluded. According to Professor Iwu himself, he said he was disappointed that it was not taken to its logical conclusion. So we need now to also work with him. He is serving on that team, and he is a very distinguished, world-renowned professor of pharmacognosy. So he's someone we value in this country in terms of his professionalism. So he will also bring that work and see how that committee, working with every other group, can take it further. The moment we're able to show that works, why not? So we are not hindering everything. I think the government should be commended that we are now ready, not unlike before when people used to accuse government that we just simply kill off ideas. We are ready to work on ideas. But what we will not do, if something is not evidence-based, we will not allow it. It is not in. This disease is a serious one, and we must do everything to ensure that Nigerians are protected.
All right, thank you for speaking with us today, and we'll get across to you subsequently for any information whatsoever to save lives on this matter.
Thank you, my
so
pleasure.
there you have it. We've been speaking with Professor Onyebuchi Chukwu, the Minister of Health, on the Ebola outbreak. We'll be back for another perspective on this matter. Join us again.